have currently a 13-year-old business system and a 9-year-old EHR. And about a year ago, we decided that it was time to replace both of those to catch up with modern times and so on. And instead of having two separate systems like we have now, which don't talk to each other, we wanted to find one that had an integrated database, so that the EHR and the business side could talk to each other. A lot of rejections occur because we have a breakdown between the front desk and the billing department, or the front desk and the doctor filling the papers out incorrectly. So by having an integrated database, everything's kept up to date. We would like the patients to have an opportunity to get more involved in keeping their medical record up to date. We would like to be able to search some of the data. We're particularly interested in the guideline aspect of Intergy, where we can have disease states and follow the national guidelines for treating those patients. We wanted to have a lot of access to the data when we wanted to have it. So when we were looking at systems, anybody that had just a standardized reports, we weren't interested in. We wanted to see flexibility. And so we were really interested in the practice analytics because it gave us the flexibility to do reporting the way we want it done, when we want it done. Well, the EHR has to be easy for the physician to use. Also, I believe that the workflow in the medical practice is going to have to change, and rather than have doctors being clerks and secretaries, I want doctors to be doctors. We decided ultimately to go with Sage because the product was excellent. In particular, the base management system, because that's what pays the bills. We wanted to make sure that that was very complete, which it was. We were impressed by the Sage sales team. They were very professional. They didn't knock the competition. They were focused on what did we want and could they provide it. And frankly, the whole Sage organization that we've met all seem to reflect that same professionalism. Cardiology can be very guideline driven, so the Sage is, I think, an ideal tool for that. Sage just seemed to have the most complete package, and they were least expensive, frankly. The clinical and financial versions have gone surprisingly well. One of the reasons that went into our decision about choosing Sage was that we have all the 9 years worth of clinical data. How are we going to get it into the new system? We don't want to start from scratch. And so they had experience with our previous vendor, and we believe them, and it seems to be going well. All the data that we expected to come over came over. Our referring physicians, I think, are going to like it because instead of getting these long notes, they're going to get what they want to see. And we hope to be able to share more data with them as part of a health information exchange, because now that we'll be tied into the hospitals, we'll be able to be part of that network. We hope to see an increase of patient flow through the practice. We expect to see our patients be more involved in their care, and we expect to have much better control over our billing operation, and to be able to hold our payers accountable to the contracts that they've signed.